Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. In this audio/video, I'll be talking about West Nile virus. Very serious sort of disease that one of the most common within the United States, continental U.S., is the West Nile virus. Most commonly, this is spread from a bite of an infected mosquito. And again, during the mosquito season, this actually spreads. There's no vaccines. In fact, there's no real treatment for West Nile virus. However, one of the good things is that silver lining is that a lot of times, if you do have West Nile virus, you don't even know you have it. One out of five who are infected develop a fever and other symptoms. 1 out of 150 infected people develop a serious, sometimes fatal illness. While it's not, that doesn't seem frequent enough, but I think this is something to pay attention to. And then prevention. Well, what types of prevention can we think of? Well, use insect repellent. There's some that are not suitable during pregnancy, like DEET. And Picardin, oil of lemon, eucalyptus, some people use. These are fine, but you need to make sure that this is good for pregnancy. And then for children and babies, dress your child in clothing that covers arms and legs. Cover strollers and baby carriers with mosquito netting. And ITN type of mosquito repellents. Bed nets are good, where bed nets are used to prevent mosquito biting. So there's natural insect repellents too. So this might be good to look at. Wear long sleeve shirts and long pants. Going to a potentially endemic area of West Nile virus. When traveling overseas, you want to make sure not only you have clothing and gear, but you're treated with permethrin. And you can treat your own items, purchase permethrin treated clothes and gear. Mosquito nets if you will be sleeping outside, and I've experienced having to use mosquito nets in India. Oftentimes it would be difficult to withstand the heat, so it would be customary to sleep outside on the roof, where in the nighttime the temperature drops a bit. Repellents externally is good to have. Keep mosquitoes out of your hotel room or lodging. This is important in a low middle income country, especially. So if you are unable to stay in a place with air conditioning or window and door screens, this is the type of precautions you need if you're sleeping outside. So mosquito nets, again, needs to be done correctly. Tuck the net under the mattress to keep the mosquitoes out. I can't give you the number of times that there was a small gap and the mosquitoes got right in through that small gap because they're looking for their next meal, and so this allows them to actually go through the net, and all it takes is one or two, and you feel the biting. So tucking this and making sure that you can take the proper precautions is especially important when you're thinking about mosquito nets and how to effectively treat mosquitoes. I hope this has given you some insight in terms of West Nile virus and prevention from West Nile virus, which is similar to the types of precautions that you would use in many different diseases like malaria. Thank you for listening.